If you're curious about medical tourism and you don't even know where to begin, then this video is for you. This is the frequently asked questions regarding medical tourism. Why are people speaking about it? Why are more and more Americans seeking it out? And I hope to address all of those questions in this video. If you've never heard of medical tourism, it is when a person travels from their home country to another country in order to seek medical care. Why would a person do that, you may ask? That may have to do with many factors. Specifically, we'll deal with the United States because the United States has one of the most challenging healthcare crises. So I'll speak regarding that. In the United States, the healthcare system is one of the most expensive healthcare systems, and that's not necessarily because of good care. That has a lot to do with several factors. One of that being the cost of health insurance, where many people are paying thousands of dollars a month for health insurance and are afraid to go to the doctor because of the exorbitant deductible that they'll have to pay in order if they see a doctor. Also, health insurance in the United States is tied to employment. So if a person loses their job, like we saw with the global pandemic, that person also loses their health insurance. So they'll have to pay out of pocket for emergency room visits or even just a basic visit with their doctor. And many people can't afford those visits. Couple that with the staff shortages, not only as a result of doctors resigning and nursings resigning because of overwhelm in the profession, but also support staff that the doctors and the nurses work with. Hospitals are also closing across the country. So the United States is really on its knees when it comes to healthcare. What's the solution? Becoming a medical tourist. Medical tourism is a lifeline for Americans who have the understanding that the healthcare crisis in the United States is not improving, but they want to take their health into their own hands. But they're a little nervous about where to go because there's so much information out there. So this video seeks to break down the basic information if you're curious about becoming a medical tourist, specifically if you would like to come on an Access Wellness trip to Colombia to experience healthcare in Colombia. I have additional videos that address the day in the life of what it's like to be a medical tourist in terms of testing and what tests are ordered, what it would be like meeting your physicians, so you can consult that video as well. So I'm just going to be looking down at my phone, so please pardon that. So as I mentioned, medical tourism has been a lifeline for Americans who cannot afford health care or medication in the United States. So there's pretty much three camps of people that become medical tourists. One, those who have insurance, but their insurance claims are denied or insurance is not covering that sort of treatment or medication, and so that person ventures out to become a medical tourist. Or there's those who don't have insurance and have to pay out of pocket for any dental or medical needs and rather do that in another country. Or there's actually those who have insurance, but that insurance is not covering that treatment. Specifically, we have a lot of seniors have Medicare and Medicaid that need implants, and it's just they have to pay out of pocket for implants. And as you know, implants in the United States, they start at $5,000 and they go up. Many people have been quoted at $60,000, $70,000 for implants, for dental implants, and so that cost is prohibitive for many people. And so medical tourism is an attractive option because the cost, specifically in Colombia, is about 50 to 60% less than what it would be if they paid for that same service in the United States. Specifically, implants are considered cosmetic in the United States, which is why it's not picked up by any insurance company, even if you have Medicaid or Medicare. In many cases, some people have the Rolls Royce of insurance in the United States, but that treatment is still not covered. It's considered cosmetic. So what are the common procedures and treatments? The most common procedures that people undergo is dental care, surgery, cosmetic surgery, fertility treatments, organ and tissue transplants, and cancer treatments. And they seek out these treatments because they get access to extensive treatment and do not have to go through the rigmarole of the insurance company in the United States, which is why it's attractive to become a medical tourist and seek this treatment in another country. So what procedures are available with Access Wellness abroad? Medical, dental, cosmetic, diagnostics, infertility, and cancer treatments, and many are. If you have a specific question about your treatment, my information is in the description box, so you can reach out to me to see if this is available in Colombia. Do I need to bring my medical records? You can bring your medical records. However, when you meet with the physician in Colombia, that doctor will order as additional medical records and testing and diagnostics for you, because he or she will want to have the most up-to-date medical records and testing as possible. So you'll have your consultation with the doctor or the dentist. That doctor or dentist will order your medical records. You'll go to the lab, do your testing. The lab sends you your results within 24 hours, and you get them, then your doctor gets them, and then you'll have a follow-up to discuss with that doctor the blood work and the diagnostics. So this gives you opportunity to review your medical records beforehand and prepare any questions that you have in the second consultation with your doctor. There's no limit. If you wish to meet with that doctor for 3-4 visits, you do have the opportunity to do that. There's no cutoff. Again, I don't want you to think of this as, oh, my insurance provider only covers this amount of visits. There's no cutoff regarding how many times you can meet with that doctor. How do I get prescriptions? We will accompany you. Your doctor will give you a script for any prescriptions that you will need, and then we will accompany you to the pharmacy to get those prescriptions. Again, there's no insurance company middleman denying or that you have to get approval for. So it's relatively easy. You can walk into any of the pharmacies and ask for a prescription. If they don't have it, they'll order it for you. It's as easy as just having a photo of the box or the prescription, and they can check their records to see if they have it. If they don't have it, they'll order one for you, or we could try another pharmacy. There's so many pharmacies, sometimes 2 and 3 on every block. In the clinic where we do your testing, there is just one block of just pharmacies. And so it's easily available for you. If you have prescriptions from abroad, you can also bring those to see if the pharmacy has them and can provide them. Why does it cost so much less? Well, the difference in cost is caused by labor and insurance costs in the United States. Because a good portion of healthcare costs in the US is tied up in administrative and insurance costs, which is why it's so much more expensive in the United States. That doesn't exist here. There are insurance companies in Colombia, but it's not a profit-driven model the way it is in the United States. And so that contributes to why it's less costly. Also, running administration costs money too. And many of these companies that are in healthcare in the United States have an agenda to make it expensive because Medicaid is covering it or the state is covering. So it's an incentive to have it be expensive because the state is paying for it. What patients are most likely to use medical tourism? Patients most likely to use medical tourism are those without medical insurance that does not cover the procedure, or the copay is very high, or the medical procedure is not available in that home country. Because like I said a bit earlier, there's 3 camps of people who want to become medical tourists. Those who have insurance, and pretty good insurance, but insurance may deny that. Or those who do not have insurance, such as myself, because the cost of insurance in the United States, I was quoted at $5,000 a month, is cost prohibitive for me. So I opted to go to another country in order for health care. Or those that have insurance, but that service is not available through their insurance company, so it won't be picked up, or it's not available, that treatment is not available in the United States. What do I do with the information? This is a question as to what does my company do with the information. We destroy your information once the trip is over. I have no incentive and interest in creating a repository of my client's information. The information I have regarding your health care is just to facilitate the program in terms of getting you to the right doctor. So if you have an autoimmune condition, I of course have to know you need to see a rheumatologist, or you may need a biologic. I do not store that information to sell you something later on. It's just to facilitate and provide ease in you getting the service and care that you need. Can I have more than one medical procedure, dental procedure at the same time? Yes, it may be possible, but it depends on why you're coming to Colombia. I would like for you to prioritize what you would like to have treated first. And if it's an aggressive treatment, you may not have the energy to undergo another treatment. So say you're coming to Colombia for a knee replacement. It's not in your best interest to also get a dental implant and then need a dental implant and a knee replacement within the same 2 weeks. So we're going to prioritize your care. What about quality? There's so much misinformation regarding the quality of care. Many people have a misunderstanding thinking because Colombia is in South America and it's not recognized as an industrialized nation that the quality of care may be diminished. And I'm here to tell you, to inform you, the quality in Colombia is exceptional. Many of these doctors have been trained abroad, so they're familiar with Western hospitals in the United States and Canada and Europe. Not only that, Colombia has done an all-out effort to be the gold standard in healthcare, ranking number 19 in the world, outranking many industrialized nations, including Canada and the United States. And so it has become a leader in the medical industry. If you speak to any Colombian, they brag about, they're so proud regarding how healthcare is run in their country. They know that Colombia is on the world stage for how efficient, innovative, advanced their healthcare is. And they know that they have pride in the healthcare in their country. So as I mentioned, the quality, it outranks the United States and Canada. It's so efficiently run. Fewer administrative hurdles. And it's run at 60-70% less than what it costs the United States to run its healthcare model. Again, this has a lot to do with the administration in the United States, as well as the insurance companies, which clogs up a lot of resources and takes a lot of resources and takes it away from care. Colombia has a healthcare model where it really is about care, and financial is secondary because the government pours a lot of money into Colombia's healthcare, which is why it's virtually free for Colombians because they have their own system as citizens, and for foreigners it's inexpensive. So in terms of quality, it's exceptional quality. Do I need to tell my doctor? Yes, you're not required to tell your doctor, but I think it would make you feel comfortable to tell your U.S. doctor that you're seeking medical tourism in another country. We can also set up a meeting where both doctors discuss your treatment. We have one client here who has a rheumatologist in Colombia and also a rheumatologist in the United States, and they consult on the patient in order to provide the patient with the best care. Do the doctors and medical staff speak English? In some cases they do, and in cases where they do not speak English, a translator will be provided for you. Can a companion travel with me? Yes, I think it would be in your best interest to travel with a companion, even though you won't be alone while you're in Colombia. My staff, as well as I, will be accompanying you to all your doctors and your diagnostic testing. If you feel comfortable with bringing someone, a spouse or a child with you to accommodate you, to help you, then you're more than welcome to have them come along with you. If I deal directly with the hospital, will my medical costs be less? No, the medical and dental facilities charge the same amount. The benefit that I provide is I provide concierge service. I provide the translation service. I get you to and from your appointments. And so that eases up any anxiety that you have about seeking healthcare in the United States. I also will be walking you through making sure that you get the appropriate testing. Make sure you get your fasted blood work, and then you go to eat, and then you get your blood work done, the unfasted blood work. So I will be guiding you through the process. So concierge service is what is provided. How do I get started? If you're interested in becoming a tourism and coming along with Actress Wellness Abroad, there is the link in the description box as well as my email so that you could reach out to me. There's a form that I asked for you to fill out just to give me some preliminary information regarding your situation. I don't know anything about my destination. Will I be safe? How will I get around? Yes, you will be safe. You will be accompanied from the moment you land in the Barranquilla airport. Our driver Luis will pick you up and take you to your accommodations. Luis and I have been working together for several years. He's like family to me, and I trust him, and you will be in good hands, as well as where you're staying in the hotel, so you don't have to worry about that. Luis will be available if you want to go out at night. I will give you his WhatsApp number, and he will arrive to pick you up, and he'll wait for you in order to take you back home. Safety is a priority in Colombia. you are handed off in this. People are invested in one another, and especially because you're a foreigner, everyone does their best to hand you off to make sure you're taken care of and that you're safe. People go out of their way to help you because you are a foreigner. What are the risks? There are inherent risks with any procedure that you are undergoing, whether you're undergoing a dental cleaning or a knee replacement. There are inherent risks in terms of, there's no more risk in Colombia as there would be in the United States. I think what people are uncomfortable with is the idea of going to another country in order to receive medical care. But understand that there are hospitals, there are thriving hospitals in every country of the world. People get sick everywhere, and doctors live everywhere. So American doctors do not have a monopoly on providing the best care, as opposed to other countries not providing, like rheumatoid arthritis in Colombia as it is in the United States. So treatments are different, but there's no more inherent risk in Colombia than there are in the United States. Do I need to get inoculated? CDC recommends the yellow fever vaccine because this is a tropical environment. However, the yellow fever vaccine is not a requirement to enter Colombia. Why is medical tourism popular? Medical tourism is becoming more popular. I would speak to specifically Americans because of the increased cost and expense of healthcare in the United States. So that is why it's driving many Americans to seek care, not only in Colombia, but in Dominican Republic, in Mexico, in Costa Rica, because these countries have become recognized for their healthcare, because they have invested in their healthcare, and so that is why it's becoming more and more popular for Americans. And the cost of healthcare in the United States is crippling. Whereas in the United States, a diagnosis can bankrupt a person can lose their home, which is why people are thinking about medical tourism. A trip they may cause cancer treatment in the United States can bankrupt a person, which is why many people are considering, well, what would that cost be like in Colombia? I won't lose my house if I go to Colombia, but if I don't have $200,000 for cancer treatment in the United States, it's likely that I will be billed for that treatment, and there's a risk where I may lose my home. So that's why it's becoming more popular for Americans. Do the facilities have the latest equipment? Yes, the facilities are equipped with the most up-to-date, advanced, and innovative equipment. Like I mentioned in the earlier question, there is no diminished quality in Colombia. Colombia is as advanced as any industrialized nation. If you have any additional questions, my link will be in the description box. Please don't hesitate to reach out to me. I really want to help people who are dealing with health conditions and are just scared and don't know where to turn, which is why I began this program to help Americans get access to health care. And just because you don't have health insurance does not mean you should go without health care. I will see you next time. Bye-bye.